Hi, my name is Vanessa Callahan,
Hi, my name is Nuthrin Namkyao.
and we will be reviewing Chapter 4, Defining Healthcare Quality and Value. Here's a quote from the book by Henry Ford: "Quality means doing it right when no one is looking."
Okay, so first is quality and value. Quality is the degree to which health services for individuals and population increase the likelihood of desired health outcomes and consistent with current professional knowledge. Quality must be defined in quantifiable terms for measurement, monitoring, analysis, and decision making and action. So quality must reflect patient satisfaction, health status, and quality of life. Value is the care provided was able to improve the patient's health, offered a positive experience, and achieved desired outcomes. There's two things under value. Value is the first one is value added and the non-value added. Value added is one way to measure the activity that contributes to the outcome. Examples of value added is performing an X-ray or performing a lab test or providing treatment to a patient. Non-value added do not contribute to the outcome and might even delay it. Example of non-value added would be the opposite, which is waiting for a transporter to deliver the patient to the X-ray room or returning a requisition that is not completed properly. So there are three components of the HCO quality measurement. It's the structure, process, and outcomes. Structure is the stable aspects of the healthcare delivery, various tools used, physical environment, and organizational features. Structure is the overall organizational features. Some of the structural elements includes numbers of the ICU beds, numbers of surgeons and nurses, and numbers of the CT scanners and their availability. The process is the activities performed by the HCO providers and the interactions to patients in the course of providing medical care. The process looks at the time arrival, the time registration starts, and the time it completes. And lastly, the third one is the outcomes. The outcome is the endpoint of the treatment. The outcome is the quantifiable endpoint, such as morbidity, mortality, readmission, and the length of stay. Here is the chart of the three components of HCO quality measurement that I mentioned before. The first one is the structure, and then it goes into process, and then the outcome. So to improve the healthcare system, the structure, process, and outcome must be measured. So next slide, Vanessa will go over the different methodologies for the quality improvement.
So some of the common quality improvement frameworks. Number 1, Plan, Do, Study, and Act, PDSA. It encourages innovation by experimenting with change in process, studying the results, and making refinements to achieve and sustain as needed. The 4 steps. Step 1, plan. Start by planning the change within the process that will be implemented and tested. Do is to proceed with the plan and make the desired change. Study is review impact and outcomes. And act is to determine if the change can be implemented as is or if you need to refine your approach. There are 3 general outcomes to PDSA. Number 1, the change is successful. Number 2, the change is promising. And number 3, the change is not successful nor promising, and you have to change your approach. The second framework is LEAN. It focuses on maximizing value of the patient and reducing inefficiencies. There are 5 principles to the LEAN methodology. The first one is specify, derived from the end customer's perspective in relation to the specific service. Identify is the mapping all of your necessary steps to deliver the service. The flow is identify all non-value adding steps in the process so that all value adding steps can flow uninterrupted. Pull is based on the patient demand. A pull system makes the service available when it is needed and not at the convenience of the provider. And perfection is the last step. That's where you repeat all the steps until no waste exists within the process. Last but not least, there's Six Sigma. The approach emphasizes the use of information and statistical analysis to improve the organization's performance, practices, and systems. The goal is to reduce the occurrence of defects and errors. There are 5 elements within the Six Sigma. The first one is intent. Its initiatives are put out to achieve significant improvement in a short period of time. Strategy is applied throughout the HCO for improvement or on individual projects within the HCO. 3 is methodology, which is broken down into DMAIC, which stands for define, measure, analyze, improve, and control. Define is identifying and stating the problem. Measure is reviewing all the available data. Analyze is studying the root cause of the problem. Improve is develop alternative processes. And control is to ensure the improvements are sustained. The fourth step within Six Sigma is tools. And there's 3 categories within tools. It's requirements gathering, statistical analysis, and experimentation. The last one is measurements. Measurements is broken down to DPU, which is defects and errors per unit, DPMO, which is defects per million opportunities, and Sigma level. The next slide, this slide shows the comparisons between the improvement methodologies, PDSA, Lean, and Six Sigma, and a process overview of each step.
So for application to current issues today, I found an article from the Villanova University. The article shows how the methodology of Six Sigma is improving healthcare. It gave different examples of how these health system is improved from the Six Sigma. The first one is from the Mount Carmel Health System. The Six Sigma helped the HCO save about 3.1 million, while employee and physician satisfaction also rates improved. The second example was from Yale New Haven Medical Center, resulted in 75% reduction in bloodstream infections and save about 1.2 million.
Second current issue we found through healthaffairs.org. The article was Taking Back Control, Can Quality Improvement Enhance the Physician's Experience? And the article spoke about the modernization of medicine, which is increasing daily documentation, data input, and all while trying to maintain the quality of care. And it is all causing physician burnout. They basically need basic improvement training and basic improvement principles and support in testing these principles. So what they have done is apply the Lean and the PDSA principles, which have served as initiative introductions to basic improvement methodologies.
So here are our questions. First question is, how can analytics improve organization using methodologies such as PDSA, Lean, and/or Six Sigma?
And
yeah.
As an administrator, which methodologies would you use to improve overall quality improvement? How would you apply it?
All right, thank you. And let us know if you have any questions.
Thank you.